So I'm going to talk about giving a sub-Q heparin injection. So it could be any sub-Q. It could be heparin. It could be insulin. And you need to make sure you have the right syringe. And so if it doesn't already come pre-made like these do, then you need to make sure you have the right size syringe, and your gauge, I have a 27 gauge, is going to be the right length needle and gauge for your patient. So it's a 1/2 inch 27 gauge. So these are actually pre-made in most hospitals, and if it has an orange top, it is a insulin. So they have pre-made it, and the company is BD that makes these. So this one is used for sub-Q, and heparin is going to be given sub-Q. So this one is 5,000 units. Now, even though it's units, we give it in milliliters. So insulin is given in units, and you can figure it out in milliliters. However, it's really, I would just go ahead and stick with your safe units. You're giving heparin units, but it is in milliliters you're drawing it up. So it is very important to make sure that you have a syringe that has milliliters on it, not units. So this is a 1 milliliter. So I'm going to give 5,000 units. That's going to be my dose in 1 milliliter. So what I'm going to do is I'm going to clean off the top of the syringe first, because even if you pop this top, sometimes it's not clean. And I'm telling you, you need to clean the top. So you scrub it for 20, 30 seconds. Let's say I already did that. When you pop your top off, you want to make sure, I'm going to give a whole milliliter. So I'm going to give a milliliter of air into the syringe. So I'm going to stick it on here, put this down, and put 1 milliliter in there. Now, as I draw back, I want to make sure I don't have any air. And if I get some, I'm going to push it back a little bit. See that big old air bubble in there? I want that out of there. There we go. And make sure that the tip of the needle is below your line of medications. So by the time you get it in there, I like to, now sometimes these needles bend, especially the little insulin ones. So if I'm going to do that, I'm going to flick it. I'm going to have a little bit more than 1 milliliter, and then I'm going to push it up to the 1 milliliter mark. So that one little line on my plunger syringe is going to be 1 milliliter. And so I'm going to do a scoop method so I don't stick myself. And then I'm going to go in the patient's room. Now, the thing is about sub-Q, you're going to read that you can do sub-Q either 90-degree angle, just straight down, or you could do a 45-degree angle, which is an angle this way. Here's the thing. Most patients have enough subcutaneous tissue that you're going to be able to do a 90-degree angle, unless they are very malnourished or they're a severe bodybuilder that they have no fat. You're going to be able to pinch enough skin to get a subcutaneous piece that this needle is going to be able to be given into. So you want to make sure I go at a 90-degree angle. I tell my students to go at a 90-degree angle. I'm going to get this a little bit. So I'm going to go here, and I'm going to go straight down. As I do that, I'm going to hold on. I'm going to inject it. And then I'm going to put my syringe all the way up. I'm going to hold it up, and I'm going to make sure I use my thumb to engage that safety. And that's how you give a subcutaneous injection. Again, 90 degrees is the most safest bet. That's how most of us do it. Even though you learn you can be given at 45 degree, your instructor's probably going to tell you, like I do, give it at 90 degrees unless we go into a room and there is severe contraindications that they don't have enough subcutaneous fat to give a 90-degree angle, and then we'll do 45. So I hope that makes sense. And follow me for more tips. Make sure you put this in a little sharps box. Let's see. So I can get it in the angle there. Yep. It's closed like it should be. Bam. Have a great day.